I am Stacy Cayetano. I am a former faculty, for a while. I am a former faculty of Our Lady of Fatima University. I am a lecturer and clinical instructor. I have taught pediatric nursing and psychiatric nursing. And as a clinical instructor, I have been with Ma'am Vilma in
What I like about it is it also has like this data
in the National Center for Mental Health. So I've decided in the year 2013 to go to the Kingdom of Saudi Arabia, and I have rendered my service as a clinical instructor for about 5 years. So I'm handling Saudi students who were from different universities, BSN and diploma. We are also managing some of the educational activities for our staff nurses in our hospital in Saudi Arabia. Our hospital is also a JCI accredited hospital, and we are running to be a magnet hospital as well. After 5 years of being a clinical instructor, I've also been a PICO staff nurse for 2 years. So we are the frontliners as well, especially during this pandemic. So this is one of the most fulfilling experience I had in Saudi Arabia. Together with this hospital, I also have met some of our previous students who have been in the Our Lady of Fatima University, and also our colleague, Miss Daisa, who will be joining with you tomorrow as well. So what I'm going to discuss this afternoon with you is a brief, only overview of my journey in the Saudi Arabia. So as we all know, that Saudi Arabia is one of the most highly preferred So still Saudi Arabia continues to be the most preferred destination of OFWs. I know some of you would like to go overseas after you finish your study in the Our Lady of Fatima. What else? And also in Saudi Arabia, according to the Philippine Statistic Authority, according to them, it is, for a while, I'm having difficulty with my okay. So 22% of OFW is in Saudi Arabia. That is why it is known as the most preferred destination of OFW. I know some of you would like or are prefer to be in the US or UK, and even in the Canada or Australia, but you can take it for me that Saudi Arabia is one of the good country to be in. So just like to give you an overview of Saudi Arabia. So life expectancy in Saudi Arabia is 70 years old and above, and its capital is Riyadh. So you can see in Riyadh, the Kingdom Tower. It is very much popular, particularly for us OFW. So the nationality is Saudi, and their religion is Islam. Islam is on. Once you are a Saudi citizen, you should be an Islam. Okay, so meaning to say you are not allowed to practice any other religion or to celebrate any other religion in Saudi Arabia. That is why if you are very much devoted in your religion, you might be having difficulty to be in Saudi Arabia. But thank God that we have here internet that we can able to utilize YouTube. We can attend masses through that. However, it is very much discreet. It's especially if we're going to practice our religion. You are also not allowed to bring your Bibles or even the pictures of Virgin Mary or even Jesus in there. So currency would be Saudi riyals. So one of the major factor why we OFWs are going overseas is that we could earn good enough money for us to sustain our finances or to send our finances to our family back home. So I'm just going to compute. So how many reals or how many pesos are you going to expect, okay, if you will be a staff nurse in Saudi Arabia? So my starting before is, okay. So you're going to have, if you're going to start in Saudi Arabia, you might have 60,000 pesos per month or as much 130,000 pesos per month. So imagine that one, if month, so that would be a large amount of money. However, there's also a backfall for that. The major language Arabic and the agriculture and industry is the petroleum. Do you know that only, what do you call this one? It is very much cheaper in Saudi Arabia to, what, if you have, for a while, okay. So how much does it cost for say example 1 liter of gasoline? 1 liter of gasoline would only be equivalent for about less than 20 pesos. So imagine how much it is much cheaper in Saudi Arabia. So as we go on in this afternoon, I'm just going to give you a back or a brief or a I'm just going to give you a brief review regarding Saudi Arabia. Okay, and how are we going to compare that one if we're going to be, or say for example, you want to be in Saudi Arabia, and how are you going to prepare, or what are your expectations on how are we going to care for our patients. So we're going to utilize our Madeline Lineage Transcultural Nursing. So it says in this particular theory, this is a comparative study of the cultures to understand similarities, okay, and even differences, culture specific across human groups. If we're going to care for a patient, we might as well to check what are the backgrounds. So for us to check the background, we need also to participate, such as this event, okay, such as lectures, or we can able to read online, or we can able to read a good book for us to be able to expect what is their way of life. So for us to know the differences and even the similarities, because we might able to be in a problem, okay, we might put ourselves in a problem if we're going to, if we are not aware regarding how to deal with our patients, okay? So Fatima students are preparing, Fatima is preparing as a student to be globally competitive, okay? So we're also going to utilize the Giger and David Hissard in our lecture this afternoon. So Saudi Arabia, if we're going to care for a patient who will be as a nurse, because as a nurse, we are caring for a patient who might have a diverse culture, but we're just going to focus on Saudi Arabia this afternoon. So we need to check their racial identification and their culture. What do you mean by culture? Culture means the way of life, okay? Meaning to say, here in the Philippines, if we're going to care for our patients, that would that be acceptable in other culture? Might as well yes, might as well no. That is why it is very important for us to check their differences or our differences for us to provide the best or the optimum quality care for our patients. We need also to check the place of birth, okay? So in the Middle East, okay, not only Saudi are we going to cater patient, we are also catering Pakistani, we also catering Sudanese, Yemeni, and so on and so forth. But the most common, of course, Saudi and also the Egyptians, okay? So the language, the most common uh, drawback for us Filipinos is that we are not very much familiar with Arabic language, okay? However, as if we're going to engage ourselves, okay, we might as well be good and we can able also to converse well to our patient, okay? In as a nurse, it is very important for us to check on how can we comprehend and also how are we going to relay the messages that we want to our patient. So I'm just going to give you some of the examples Arabic language. Okay, for the K dramas out there, okay, you know, annyeonghaseyo. But for Saudi, we're going to say it marhaba. Okay, marhaba is hello or welcome. Okay, marhaba. Okay, what else? So this is assalamu alaikum. So if you're going to knock in the door of the patient, if you want to start a conversation, you need also to say salam alaikum. So what does it mean? Okay, it means peace upon peace upon. And shukran. What do you mean by shukran? Okay, it means thank you. Okay, again, marhaba, that's a hello. Salam alaikum, that means uh, hello. Okay. Salam alaikum. That is one of the most common greetings, and also shukran. So these are the most three common words that you need to carry all throughout your shift in if you will be in Saudi. So most of them are having not high pitched voice, but their voice might as well be different on how they're going to convey with us. But also, it also depends on case to case basis. Say, for example, for those uneducated, okay, they tend to be speaking on a higher tone of voice. What for those educated, they can able to regulate their voices depending on their situation. So just don't be scared if they're going to raise their voices. Some of them, that is also normal for them. Some of the therapeutic communication that we can also utilize in communicating with our Arab with our sorry with our Arab patients would be silence. Okay, if we doesn't know what they're pertaining to, if we doesn't know their language, okay, we also need to seek other colleagues or even interpreters who were available for us to utilize or for us to give the optimum potential of care to our patients. There is one also, most of the, there is a one common nonverbal communication method that was used by the Arabs. It is like this one, okay? It is a palm facing up, okay? And like this. What does it mean for us Filipino? We might misinterpret this one if as if they are asking us to eat, okay? But it means this one, for a while, or kindly wait for a minute. Okay, so recently, I believe in Android, they have included this particular sign, hand sign gesture, to be included in the emoji. Okay, so what does it mean again? If you have seen an Arab saying or placing this sign in your face or in front of you, it means just for a while or wait for a minute. Sometimes if you're just going to place this one in your patient or in the relatives, they might understand you easily rather than explaining everything to them. So space, are they very conservative? Yes, Saudi, particularly the Arabs, especially their religion, they are very conservative. So how does it It signifies it signify sorry it signifies the space. How about proximity to others? If we're going to see them closer to you or drawing in you, they might be female or children, okay? Because if male, say for example, I'm walking, it is not allowed for them to it is not allowed for them to come near with me. Okay, why? Because it is their culture. There is one time during my what do you call this one early days in Saudi Arabia. I got lost in my way, and I have asked one gentleman regarding uh, the direction that I will be needing into. However, he just ignored me. So what I think is that he is snobbish or he doesn't want me or he's very busy. Okay. Later that I know that they are not allowed to engage with their opposite sex. Okay, with their opposite gender, especially in public. Okay, so you should also consider not talking to your opposite gender if you'll be in Saudi Arabia. What else? So say for example, there is a male doctor and you have female patient. Are you allowed to go to other room or to their room, or are you allowed to let them be in their own? No, you have to be present. Okay, so male doctors and female patients are not allowed to be in the room together. Okay, there must be a third party. Also, they should wear abaya. So say for example, the female sister or the female patient is in her regular dress. You're going to tell to the to the patient that sister, the doctor will be coming and he will be male. Kindly wear your abaya because they are not allowed to see the patient in their regular clothes. Okay? They must wear their abaya. So what is this abaya? Okay? Abaya is the dress in Saudi Arabia in which it is usually black and it is until ankle and also until it is a long sleeves. Okay? And running until through ankle. So they must wear that one. How about the tarha? What do you mean by what do you mean by the tarha? Tarha is the hair covering of the of the Muslim patients or Muslim friends. Okay, so it must be worn all throughout the conversation of if the patient is female and if the doctor is male. So you also have to consider that one. So as you all know, in Saudi Arabia, this is the last country that provided or that have granted for the female to drive. Okay, so this is the last country. So I think in 2018 they have lifted the ban for the women to drive because women are not allowed to drive in Saudi. Okay, so that is the last country that was not allowing females to drive. You can almost you can also see some of the even I think even grade schoolers, okay, even high schoolers who doesn't even in the legal age, say for example 10, as long as it is male, they can able to drive their cars, okay. But nowadays, women are also permitted. What else? Okay, the male the males are the one who are going to decide in Saudi Arabia. So say for example, I would like to ask my father that I would like to study abroad. Okay, if he says no, I can't study. Okay, that is their life in Saudi Arabia. Or somebody permitted me to study overseas. He's going also to send my brother with me overseas even if I'm the only one who going to study. So it's very difficult for them. Okay, imagine po ang toxic. Say for example, I'll be going to US. My brother will tag along with me in my schooling in the US. So that's how Saudi works. And also, if they're going to release the child, say for example, the child is in the nursery, still newborn, they will only be received by the father. Okay, no father, the baby will not be able to be released. Say of course, there is also exemption. Say of course the father died or the father is very sick. Okay, as long there is a male guardian, that's the only one who's going to take the baby out of the hospital. How about their leisure? Do you think Saudi is very boring? Okay, for some, yes. Okay, but for the locals, they've managed to find their ways to be, to have their social orientation. Do they have theme parks in Saudi? Yes, they do. What else? What are the other things that they're doing? They also love to travel. Okay, so this is the Taif region. So this is where I came from. It is the summer capital of Saudi. Okay, so it is like a Baguio counterpart in the Saudi. And all throughout this highway, okay, there are many baboons in Taif. What else? How about other leisures? Okay, do you know horse racing? Yes, of course. But for them, Saudi, they also have camel racing. Okay, so it's very, very entertaining for them, especially this camel. Do you know how much camel costs? It costs about 250,000 pesos or even millions of pesos. So make sure if you're going to drive in Saudi Arabia, just to make sure not to hit the camel or else you're going to pay that much. Huh? Do they have friends? Yes, of course. Most of them, what do they do? Okay, they usually go to the malls. Okay, so this is the abaya. This is the one that they're going to wear if they're in the public. So for conservative types, they're also wearing gloves and only the eyes are seen. Can you see this one even overseas? Yes, particularly for those who have conservative fathers. Okay, they're not going to allow their children, especially their wives, to put their regular clothes on. Okay, they must be in abaya. What else? How about church? Okay, are they very conservative? Yes, and they pray too much. How many times do they pray? They pray for about 5 times in a day. So, ma'am, say for example, I have a patient who is Islam, and I'm going to expect to pray for them to pray in their bed. Okay, they're going to pray wherever they're going to be in. Say for example, how about in the malls, ma'am? Say for example, they'll go to Trinoma. Say for example, are they going to pray in Trinoma, ma'am? Yes. Okay. How about in the street? Say for example, they're in EDSA or they're in Karuhatan. Are they going to pray in Karuhatan? Yes, they will going to pray. But for those who are patient and they cannot able to stand or kneel, they also have their different counterparts in praying. That is why if you're going to care for your patient, you need also to give the space in their praying. Okay? Say for example, you're going to give medication, you need to give health education to your patient. You need also to consider their praying time. How about social time, ma'am? Okay? Most of them are to the park. Okay? And in the park, uh, there are some, they're just going to provide some distance with each family. Usually, they are going to the park every weekend. Okay? And not just park, even in highways. Is it true, ma'am? Even in highways, yes, even in EDSA. All they're gonna do is that they're just going to put their mat in the side of the street, and they're going to enjoy their tea. That is why during summer, most of our cases in pediatric ICU would be scorpion bites. Okay, it's more scorpion bites or snake bites because they're just going to have their picnic wherever they want, particularly in the side of the street. How about work time? Are Arabs considered punctual? No, they are not punctual. Okay, but is it a good sign or is it a bad sign? It is a bad sign. However, it is their culture. Okay, because say for example, on their way and they have met their friends or they have met their relatives, it is very much important for them to engage with their friend or relatives that they have passed through. Okay. Do they have more breaks? Yes, they do have more breaks. Okay. How many breaks do they have? Numbers of breaks. Okay. Twice, thrice, four times. However, the good side is that most of them are finishing their jobs ahead of time. That is why they also have a good number of break time. How about plants? Okay. Do they also consider herbal plants in Saudi Arabia? Yes, they also having herbal plants. However, we must stick in the hospital policy. Why? Okay? Because herbal plants must be, if we're going to give any any medication, it must be dispensed by the pharmacy. Okay? Sometimes there is one incident in our what we call this one in our hospital. The patient do have third-degree burn in his forearm. Okay, and then it is visiting hours. The mother have placed leaf in the patient's hands. Okay, and that it became infected. So please do make sure if you're going, do not leave your patients unattended, particularly for those who are not educated parents or for those who are not educated enough. They are all still believing with regards to the Asian traditions. Okay. How about Samsam? What is it? Samsam water. Samsam water. It is believed that this Samsam water can able to cast away infection or even cast away the illness of the patient. Why? Why is it that much important? Or why is it that much a big deal for these Arabs or for these Muslims? Because this water was for them it is a religious water. It was taken within the well of of their sacred place. That is why they are considering it as a therapeutic water. But question, are we allowed to let them or are we allowed by the hospital to let them drink this water? Okay, the answer is no. Okay, all the medications and all of the food that was taken by the patient must be issued by the hospital. Okay, so you have also to be careful with this one. What else? So if you can see these slides, what can you able to see? There are cauterized marks. Okay, so is this a child abuse? Yes or no? No, this is not a child abuse. They call this one as a traditional Asian cautery. They are cauterizing the skin of the patient. Okay, so it depends also on on where the on where the illness has been located. Okay, and question, ma'am, how many? How many cauterized are we going to check for this one? It depends. Okay, according to one of our colleagues, it ranges from 1 to 7 cautery. This one. Okay, so don't be shocked if you can able to see this one in your patient because this is patient traditional cautery. Okay, some of the parents are still practicing this one. especially if their children do have chronic illness. So where is the location, ma'am? Mostly in the abdomen, but you can also find them in the head or even in different parts of the body. Okay. So please don't expect that this is what child abuse. Okay. These are traditional Asian pottery that they believe that it can cast away the diseases or even the infection. Of course, are there any complications with regards to this one? Yes. Okay. Possible infection and also possible what? Possible more complications, such as, uh, say for example, since they are, what we call this one, since they are since they are thinking that cautery was being provided with their child, okay, the illness was done. The illness might be neglected and it might have further complications. How about their body structures? They are very curvy, okay? What else? How about the skin color? According to my Saudi friend, the original Saudi color is the dark skin, okay? But now we can able to see all the different palette of skin colors in Saudi Arabia. How about hair colors, ma'am? Do they have also beauty salons in Saudi Arabia? Yes, they do. However, they're investing in mascara and even eyeliners. Why? Because as you know that they are covering their hair. Okay, so they are investing in their eyes, eyeshadow, mascara, and even what else? Eyebrows. Yes. How about biological variation, ma'am? Okay, in Saudi Arabia, their consanguinity is still practiced. Especially there, according to the studies, 57% of the Saudi Arabian couple are still related with each other. 80% in each relationship is their first cousin. So what is the significance of that one in our healthcare? Okay, most of them, their offspring or their children might have mental retardations and also some other uh, rare diseases because of their blood relations. Okay, but good thing in Saudi Arabia, particularly in the hospital that I have worked to, is that everything is free. Okay, as in everything, ma'am. Yes, everything. Okay, the bed. The as a matter of fact, they doesn't even have cashier in the hospital because everything is free. Okay, even they stay there for about 3 months, no problem. There's no they're not going to pay you for anything. What else? And if they are going, say for example, the doctor ordered this patient may go home, okay, they can even take with them some even hospital bed, even nebulization kit, everything that was been prescribed to them, they will going to take. Okay, so everything is free. That is why sometimes they are taking it for granted. They are not appreciating it because everything is free. How about susceptibility to illness? Of course. So in our we're still on pandemic. So coronavirus is still particularly the MERS-CoV was in fact camel was one of the biggest factor regarding this one. So in our triage, we are still included. Have you taken or do you have encounter with a camel or have you eaten a camel meat? Ma'am, camel meat can this be eaten? Yes. As a matter of fact, there is a camel meat in the what do you call this one? In the meat section of our grocery store. Okay. So they are very susceptible to this MERS-CoV. How about their coping, ma'am? Say, for example, they are in stress, they are patient. Say, for example, they are newly diagnosed as a DM patient. Who are their support systems? So Saudi are very much family oriented, particularly the grandparents. So they're very much supported with the history with the diagnosis and with the well-being of each other. How about nutritional preference or deficiency? Okay. Do you guys love pork sisig? Okay. Unfortunately, pork is not allowed in Saudi. All you're going to enjoy are the halal products. Ma'am, question, how about if I would love to have ice cream, select ice cream, okay? Is it a halal? Can I enjoy that one in Saudi Arabia? Yes, as long as it is halal. So what are the foods that you can able to enjoy in Saudi Arabia? Of course, you'll be having shawarma. Shawarma, ma'am, yes. Shawarma, the legit shawarma. And so on and so forth. So components of a culturally competent care. So for us to be able to provide competent care, particularly in a diverse community, we need also to emphasize again. We need to check, assess, and we need to be abreast regarding what are the weakness of each particular patient. So here are some definition that we can prepare ourselves if we're going to care for them. We must be culturally aware, okay? Cultural awareness, what does it mean? We need to involve self-examination of an in-depth exploration of one's culture and professional background. So we need to check ourselves. Do I know this particular culture because I'm going to take care for their patients, okay? What are the things that I need to know? What are the things that I should not do in front of the patient? Okay, so that is cultural awareness. It involves self-examination. You need to examine yourself. You need to reflect, okay, within yourself. How about cultural knowledge? Is this the one that we are doing right now? Yes. It involves seeking, obtaining information based on a different culture and ethnic groups. Meaning to say, you can able to check YouTube, you can able to attend lectures, or you can able to read some magazines or some supportive articles that can enhance your cultural awareness. Next, cultural skills. So what do you mean by cultural skills? It involves the nurse's ability to collect relevant cultural data regarding patient, presenting problems, and accurately perform a cultural specific assessment. How about cultural encounter? It is a process that encourages nurses to directly engage in cross-cultural interaction with the patient from culturally diverse backgrounds. So this is your urge to know and to assess and to engage yourself in different patients for you to be able to know their background. Cultural desire, okay? So this is your motivation, okay? This is your burning desire, okay? To be or to seek on to be aware regarding the cultural encounters that you might face ahead once you become an uh, Philippine RN. Okay, take home message. So and you have to enjoy your journey, wherever you may be, whatever you're going through, you have to enjoy it. Okay.